Thank you for joining part one of the virtual workshop, Innovation in Drug R&D for Prevalent Chronic Diseases. This portion of the workshop will discuss discovery and preclinical stages of drug R&D, and it'll set up a part two for discussing the clinical research for prevalent chronic diseases. All parts of this workshop are convened by a standing body at the National Academies of Science, Engineering, and Medicine, the Forum on Drug Discovery, Development, and Translation. The Forum offers an ongoing neutral venue for stakeholders across government, academia, industry, foundations, and consumer and patient groups to discuss and confront issues of mutual interest and concern. Through the workshop and other activities, the Forum brings together thought leaders to focus public attention on critical areas and foster collaborative activity to understand and address these issues. In accordance with the National Academy's procedure, an independent planning committee organized the workshop. You will see that a slide will be showing the members that were involved, the members of the planning committee, and the bios of the planning committee will be in the briefing book or on the workshop webpage. I'd like to thank the Forum for the leadership and support of this workshop, and especially the planning committee for their vision and efforts to put this together. Few important notices before we get started. First, about the National Academy's workshop. While this is a standalone workshop and it's not part of an ongoing consensus study by the National Academies, it's a starting off point for future activities related to innovation for prevalent chronic diseases. A summary of the presentations and discussions made during this workshop will be prepared by the reporter and will reflect what transpired at this workshop. It'll be prepared in accordance with the institutional policies and made broadly available to the public. All views presented in the summary will be those of workshop participants and attendees and will not contain findings or recommendations by the planning committee. The summary will be made broadly available to the entire community. Finally, some notices about the actual workshop logistics. For those participating in the Zoom meetings, please remember to keep your cameras off and your microphones muted unless the moderator has called on you. If you have a comment or question, please add them in the comment box on Zoom. For those who are attending by webcast, you also have the option to enter your comments and questions in the Q&A box on the website under the webcast video window. Make sure that if you're in the full screen mode of the webcast, you may not see the Q&A box, so you may have to exit out of the full screen to see the Q&A box. There are also hashtags for this workshop, hashtag chronic diseases and hashtag drug forum. These will also be flashing on the slides during the workshop. We highly encourage viewers to share their insights and make any observations on the workshop through social media using these hashtags. But please note that only comments submitted to the Q&A box can be incorporated and answered in the summary of the workshop. So if you put questions into the hashtag, you won't be able to get that included. So thank you again for joining us, and I'm going to pass this on now to my co-chair, Carl Garner.
Good morning. I'm Carl Garner, and I'm very pleased to be able to co-chair this workshop, of this three-part series of workshops with ANANTHA. We worked on this topic for a while now, and we're very excited to be able to start the sessions today. A couple other housekeeping things before we get into the agenda today is you'll note in the briefing book, the agenda, we have a couple of breaks, one 30-minute break at 12:30 Eastern time that'll follow our morning panel discussion. And as ANANTHA, I think, mentioned, the workshop is being transcribed to aid in the writing of the summary of the proceedings of this workshop, but staff will use it only for preparing those proceedings. Again, the audience members asking questions or providing comments, please enter your thoughts directly into the Q&A box under the webcast video window. And let me remind speakers and attendees that there might be a slight delay given the virtual format of the meeting, so be patient with us as we wait on your comments and questions to come in. Video recordings or slides from today's workshop will be posted on the workshop website within about a week of the workshop, so a week from today for this session 1 of the workshop. And note that throughout the day, speakers will be introduced by affiliation and title before each session, and that detailed bios for the speakers today and the moderators can be found in the briefing book. For the purposes of this workshop, unless specifically stated otherwise, it's assumed that all comments made are the personal views of the participant and not statements made on behalf of their organizations. The National Academies are committed to the principles of diversity, integrity, civility, and respect in all of our activities. We look to you to be a partner in this commitment by helping us to maintain a professional and cordial environment. All forms of discrimination, harassment, and bullying are prohibited in any National Academies activity. Let me now turn to an overview of the workshop today and introduce some of the themes that we'll be talking about during the session today. As ANANTHA mentioned, of course, the title of the workshop is Innovation in Drug Research and Development for Prevalent Chronic Diseases. Half of Americans live with at least one chronic disease, such as heart disease, cancer, stroke, or diabetes. These and other chronic diseases are the leading causes of death and disability in the United States and are a leading driver of healthcare costs. Yet investments in these leading causes of death and disability, other than cancer, has not kept pace with the public health need. Published data from Bio has recently shown that venture investment for drug development in areas such as psychiatric disorders, cardiovascular disease, diabetes, and respiratory diseases has declined over the last decade relative to the prevalence and the healthcare cost of those diseases. And the recent outbreak of the COVID-19 has further exacerbated the health disparities associated with highly prevalent chronic diseases. There's lots of evidence out in the public domain, but one in particular, a case series from hospitalized COVID-19 patients in the New York City area, showed that the most common comorbidities are hypertension, obesity, and diabetes. And we know now that those also represent the highest risk factors for developing severe COVID-19 disease that can lead to hospitalizations, intubation, and death. So these highly prevalent diseases that we're going to be talking about and thinking about ways to incentivize them are important not only to the public health broadly, but the immediate situation that we find ourselves in even today. The workshop, again, will be in 3 parts. Part 1 today, we'll discuss the key opportunities and challenges for increasing investment, broadening biospecimen collection and registry use, and supporting innovative discovery and preclinical research for the prevalent chronic diseases. We'll divide today into 4 sessions. In the morning, we'll have 2 sessions. Session 1 will be an overview of R&D for prevalent chronic diseases. Session 2 will really dive into some of the funding and investment decision-making and discovery research. There we'll examine common causes of failures in discovery research for prevalent chronic diseases and how these failures could be avoided or go, no-go decisions can be accelerated in the future. We'll discuss also whether investments or cultural incentives are in alignment for spurring the type of R&D that's needed for these chronic diseases. And we'll consider factors that determine which research areas key decision makers use the most to make decisions on moving forward investments and programs seeking to find cures or address these chronic diseases. That'll be our morning session. We'll take a 30-minute break after that, and then we'll come back with session 3, biospecimen collection and registry use and drug and discovery research. We'll consider the lessons learned from other disease areas that could have cross-cutting applications for the diseases that we're talking about here in this workshop. And we'll discuss the availability and need for biospecimen repositories and data sets to help enable development in these areas. And then in session 4, we'll cover new technologies enabling discovery research. Again, looking at cross-cutting challenges in preclinical research for these diseases and consider how well new technologies could help enable researchers to overcome these challenges and accelerate the development of potential medicines for these diseases. And we'll, of course, learn from other disease areas which new technologies have served the same purpose and learn from those. So that'll be our sessions today. And then I'll remind you that the next 2 Mondays, March 1st and March 8th, respectively, we'll have part 2 and part 3 of the workshop. So we'll consider more of the development, translation, and regulation and support of clinical research next Monday. And then the following Monday, we're going to cover a series of case studies that I really hope you can join us for in both discovery and clinical research that could lend insights and lessons learned that can be translated more broadly to these disease states under the scope of this workshop. So now let me introduce to you the moderator of our morning session, Susan Shekhar. Susan is the president and CEO of the Patients Academy for Research Advocacy. She founded the Research Advocacy in 2018 after spending 15 years of informing and educating our industry and our stakeholders on best practices and new thinking in clinical development, regulation, pricing, and market access. Currently, as chief editor of BioCentury's product discovery and development, Shekhar became an early champion of patient-centered R&D as an essential practice for translating great science into medicines that patients really want and the societies are willing to pay for. Her work has been cited in numerous regulatory filings and influenced global biopharmaceutical companies to begin working on unique and innovative pricing experiments that can improve access to these innovations. She's a frequent speaker at private and public events, including the annual Bio International Convention, the Leaders in Global Health Technology Forum, the Revolution Symposium for CSOs, and the Milken Institute Future for Health Summit. So with that, Susan, I welcome you to the morning session, and thank you so much for moderating our 2 sessions this morning, and I'll turn it over to you.